thank you all very much for taking the time to come and share your morning with us in this joint visiting committee meeting. It really is incredibly useful for us that you come here and engage with us, that you have discussions with us to help us understand how we can best order our priorities, that you can help us think about how we strategize so that the things that we do at Dana-Farber maximally impact all patients with cancer, patients at Dana-Farber and around the world. And the fact of the matter is that you really do influence what we do. And last year's visiting committee made several suggestions in important areas, and those suggestions were given to Dr. Benz. And what I want to do this morning is report to you what we've done in the areas that you highlighted as being very important for us. But before I do that, I want to point out that in FY16, we actually had a very good financial performance. We had a very healthy margin. And the reason that's important is because I could not be telling you about the things that we've done without a healthy margin. And it's important to remember, to keep in mind, that our margin depends extremely heavily on philanthropy. So without the generosity of the people in this room, others in New England, around the country, and even around the world, we wouldn't have had that margin, and I wouldn't be able to report to you the successes we've had over the past year. And there's a sort of a summary of our financial position in your folders this morning. So let me talk a little bit about the areas that you highlighted as being important for us as we thought about our activities for last year. There are really 5 areas. The first is something that Lori referred to last night. It's this combination of performing cutting-edge cancer research combined with outstanding cancer care. That's one. The second was to we needed to exert ourselves to have a higher standing in terms of national marketing. The third was to continue and expand on our community outreach programs. The fourth was to rely and sort of engage even more in strategic planning, both around our clinical plans and our research plans. And then the final thing had to do, again, with philanthropy, recognizing how important it is and how essential it is for our operations and find ways to expand that. So let me talk a little bit about what we've done in the past year in each one of these categories. So the first one is this idea of combining outstanding research with outstanding patient care. And so a couple highlights of the past year. Almost exactly a year ago, in October of 2015, the FDA approved 5 new drugs for cancer indications, 5 new anti-cancer drugs. And each one of those had the fingerprints of Dana-Farber all over them, either Dana-Farber scientists themselves or clinical trials in the Dana-Farber Harvard Cancer Center. So we continue to have a major influence on how new medications and new approaches to cancer treatment are derived, and they have foundations in the research that we do. Another highlight was in January of 2016, the accrediting body for hospitals, the so-called Joint Commission, made its visit to Dana-Farber. And not only did we get reaccredited, but in their sort of exit statements, they were saying things to us like, the way you provide cancer care is the way everybody should provide cancer care. It was an incredibly gratifying endorsement of our care model. And then in June of 2016, there's this huge, the way I think of it is a sort of our trade meeting. It's the American Society of Clinical Oncology. 30,000 oncologists from around the world gather at this meeting. Dana-Farber has always had a major presence at this meeting, and we did this again. We had over 70 presentations from Dana-Farber scientists and clinicians, and we continue to be a force in that organization, and our colleague Bruce Johnson is actually going to be president of that organization the next year. So that's the first point. The second, around national marketing, I think one of the ways that we can think about what our impact is where do we rank in the US News and World Report rankings. Dana-Farber Children's was ranked the #1 hospital for pediatric cancer care for the 2nd year in a row. Dana-Farber Brigham was ranked as the #1 cancer hospital in New England for the 16th year in a row. We were 4th nationwide. And it's important to keep in mind that we are the only cancer center in which both the adult and pediatric sides are in the top 4 in the US News and World Report rankings. When we think about the next point, community outreach, last year we began an initiative with the Boston Public Schools and with the Boston Department of Public Health around vaccination against the Human Papillomavirus, or HPV. HPV is responsible for the majority of cervical carcinomas and many other kinds of cancers, including head and neck cancers in adults. There's an effective vaccine. It is part of our responsibility when we think about prevention, as we discussed last night, to promulgate and help the city and the Department of Public Health think about ways to maximize vaccination rates in the city. Around strategic planning, in June of 2016, we brought into our satellite group, or into our network, Stamford Hospital. This is part of our strategy to increase our footprint around New England, and it was really the first hospital in Connecticut that is now part of our network. We continue to have, when we think about strategy, one of the most important things we do strategically is think about new talent, making sure that we have the best new talent at Dana-Farber. Many of you are aware that we have a fellowship training program in medical oncology. This is the #1 fellowship training program in medical oncology. We bring the best and the brightest to our institution every year, and this is important for us in terms of long-term strategy because I would say the majority of our faculty have been culled from that fellowship. And so continuing to make that fellowship strong and vibrant is very important for sort of the future of Dana-Farber. It's seed corn, if you will. And then for philanthropy, there are several things that we do at the Institute, some of which are flagship projects, and they would not be possible without philanthropy. One of these is our profile project. You heard a little bit about this last night. We were the first and still the only institution that attempts to get a genetic profile on every patient who comes to Dana-Farber, the Brigham, and Children's. It's an incredibly successful project. Insurers don't yet cover the cost of this, so the only way we can do this grand experiment is through philanthropy, and that's been very successful so far. When we find the mutations in patients through the profile project, for example, we want to be able to treat them with drugs that are specific to their mutations, the things that are driving their cancer. That's the essence of precision cancer medicine, which you're going to hear more about this morning. There are some drugs that do this, but not enough, and that's why we have a chemical biology program to try to figure out new ways to come up with drugs that will affect and take care of these driver mutations that you heard Lori talk about last night. We can't rely on industry to do this alone, and so we have our chemical biology program, and we could only begin this with philanthropic donations. In particular, the Lindy family has been right at the forefront of supporting chemical biology. And then the other area, again, which Lori talked about last night, is immune oncology. You know now about these drugs that re-energize the immune system to be able to fight cancers, and we have these amazing results of people who are heavily pretreated, resistant to other kinds of therapies, having major and prolonged responses to these immune oncology drugs, so-called checkpoint inhibitors. So we have a history with this, but we need to pounce on this now. Now is the time to do this. And one of the ways that we're doing this is through creating a Center for Immune Oncology, led by Steve Hody and some of his colleagues. Again, the only way we can do this is through philanthropy. We want to be able to bring immune oncology into profile. The only way we can do this is through philanthropy. And then finally, around philanthropy, our patient population is expecting us to provide things that they want and need. And in this case, I'm talking about integrative therapies, things like Reiki, things like acupuncture. And we can do this through the Zakim Center, but it's very hard to get reimbursement for that. So again, the only way we can do this is through philanthropy. So in those areas, the things that you told us about, we have had a lot of successes in the past year. We've done a lot. There is so much left to do. So much left to do, and there are challenges around every one of these areas where we're trying to do even more. But with challenges come opportunities.